Now,
Alright, so we are going to show you the collateral taping job for the knee. So this is for an injury for MCL on the medial side or LCL on the lateral side. So we're trying to reinforce those either side of the knee for after an injury to MCL or LCL. So you're going to start with a proper position, asking for potential allergic reactions, this and that. You can also spray, especially for athletes who are going back to activities with this tape on. You should put a spray on. Pre-wrap is optional, but for most part you could, it might be helpful, especially because you're going through a larger area. You're going to put a heel wedge under here on the foot, or on the heel, just so that the knee stays in a relative flexion and they don't have to do that flexion or maintain that flexion actively all the time. So you're going to start the pre-wrap about 3 to 4 inches below the knee joint. Right? Now recommend putting a heel and lace pad on the back so that friction would be reduced. You're going over and about 3 to 4 inches above the joints. You're going to place 2 anchors, 2 to 3, on the proximal part with the white tape, and you're going to put an anchor. Make sure to go over or beyond where you have the pre-wrap on. So 2 anchors up here, 2 anchors down here. Now you're going into the MCL or collateral reinforcement taping. So if the person has injured an LCL, you're going to put an X, or kind of a 3 lines, a vertical, one going across, another one going across to apply over where the ACL would be. Right? So I'm just going to come on this side. I'll apply a vertical strip. Then one's going across, and where that X is meeting should be about where that LCL is going to be. So just when you're starting, you can do it one more time just for the heck of it, or for better protection, or you could the one series of vertical and X will be sufficient enough. Obviously for the MCL, I'm going to turn this way again, and Rachel, if you want to turn this way just a little bit more so people can see. That vertical and X will be on the inside, so locate in the joint and MCL. I'm going right down. And series going diagonally. So that X pattern. And you're going to close off with anchors on the bottom or on the distal part, and anchors top on the proximal. Right? So I'll just do that here. So here is the MCL, LCL collateral knee taping for those injuries.